Hey Kainoa, I'm needing to take your blood sugar. Is that okay?
Yeah, of course.
Okay, have you had your blood sugar taken before?
I have.
Okay, great. So this is my simulated kit. I'm going to open my kit and my simulated alcohol swab. Do you have a preferred finger?
We'll just use the pointer
This
finger.
one. And then do you want it on the side?
On the side would be
on the
the
side,
best.
okay. So I'm gonna wipe your finger and let it dry. Then if I had a lancet, I would be using that. And then if I had a glucometer and one of those blood readings, like the strips, I'd put the strip inside the glucometer. And then that is, the finger is dry. So now I'm going to take my simulated lancet and I'm gonna poke your finger. I see a little bit of blood, and I would take my glucometer and put the blood on the strip, and it would read the blood sugar, and then I would put a cotton ball on here so that it stops the bleeding. So your blood sugar is 500, okay?
Okay.
Okay, and do you know what that means?
No.
Okay, so your blood sugar is really high. The doctor has ordered insulin, and there's a sliding scale. So you have 500, your blood sugar is 500. I'm gonna look at the sliding scale on your orders, and it says that between 500 and 549, you get 8 units of insulin.
Okay.
Are you okay with receiving insulin? Okay. This is my simulated insulin Lispro, which is a short acting. And this is my simulated insulin syringe. So
Before drawing up the insulin, the nurse does 3 checks with the 5 rights: right patient, right drug, right dose, right time, and right route.
8 units of air into this vial. And I'm gonna turn it upside down, and I'm going to get 8 units out into my syringe. And I'm gonna verify with another nurse according to the sliding scale and what I have in my syringe. And I have 8 units, which is appropriate for your blood sugar of 500. Okay? And then can you verify with me your name and date of birth?
Kainoa and 8/10/84.
Perfect. And do you have any allergies?
I do not.
Perfect. Okay. So I can give this to you in your abdomen, or I can give it to you in the back of your arms.
Let's just do the back of my arm.
Back of your arms. Okay. So I would take a alcohol swab, and I'm going to just clean it with gloves on. I have gloves on. And this is clean. I have my syringe. He's already consented to receiving the insulin. Then I'm going to bunch the skin. I have gloves on, and I'm going to give it at a 90-degree angle. 8 units. Okay, Kainoa, can I see your water real quick?
Yeah.
Okay, so it looks like you had how many milliliters to drink? Well, it's almost 2 cups. So there's 30 milliliters in a cup. So you've had pretty much 60 milliliters. Okay, so I'm going to fill this up for you.
Okay.
Okay, so we'll
The nurse measures the volume in the cup and refills their water.
fill this up all the way. Okay, so I want you to drink as much as this is possible, okay?
Okay.
You don't have to drink it all right now, but we want to make sure you're getting enough fluids, okay?
Okay.
And I'm also going to take your vital signs. Is that okay?
Yeah.
Great. So I'm going to apply this blood pressure cuff.
The nurse applies the cuff and takes his blood pressure.
Okay. And I'm just going to simulate doing this. So I'm going to put my stethoscope on. Okay. I'm just gonna. Your arm doing okay?
Yeah.
Okay, great. And then I'm going to listen to your heart. Is that okay?
Yep.
Okay.
The nurse listens to the
then I
apical
would
pulse
do
when
this
measuring the
for-
heart rate.
I
This
would
is
do
preferably
each
done
point
under the
for
patient's
60
gown.
seconds. So I'm just gonna. I got your heart rate, and then I would just continue talking to you and measuring your respirations as well, not letting you know that that's what I'm doing, because I want to alter your respirations. And then if I had a pulse ox, I would take your pulse, would at least get your oxygen saturation. Okay, I know I'm here to do a quick skin assessment. Have you had that done before?
No.
Okay, do you remember your admission assessment when we checked you out from head to toe to see if everything was working okay?
Yeah.
You remember I took a look at your skin, I pinched your clavicle?
Yeah.
Okay, well I'm doing the same thing, but instead of doing more in depth, I'm just looking at your skin, okay?
Okay.
So I'm looking for edema, seeing if you're hydrated, if you have any skin issues, pressure sores or anything, okay?
Okay.
So I would look at what's already available to me. I look at your arms. I don't see any edema. I don't see any redness, infections, anything. I would pinch your clavicle to see if you're dehydrated, and it looks like you're hydrated. The skin on your face looks good. And I would take a look at your legs as well. I don't see any edema. And if we were in a hospital setting, I would look at your feet, make sure to take off your socks and see if you had any injuries, especially on the bottom of your heels, in between your knees, and on the bum. So I would move you to your side and look at that as well. Okay, Kainoa, I'm here to teach you how to take your blood glucose. Have you taken it before?
Only when I go to the doctor's office or whatever, they do it for me.
Okay, so you're not taking them routinely at home?
I'm not.
Okay, well this is really important, so I'm going to teach you how to do it. It's not super complicated. This is our simulated glucometer kit. So I'll let you take a look at it. We have, this is your actual glucometer, okay?
Perfect.
So it has different settings, and there's, on the end, there's a spot where you can insert a test strip, okay? So the part that looks kind of like, you know, on your credit cards, it has that chip on it.
Yeah.
That's what you're gonna insert into your glucometer.
Okay.
And on the end, you see that little part that has kind of like a divot inside.
Yeah.
That's where you're gonna put the drop of blood.
Okay.
Okay, so we would have you put that in the glucometer, and we also have a alcohol swab.
Perfect.
So you're gonna need that to wipe your finger. So let's see, which finger would you like to do it on?
We'll do it on this finger right
On
here.
that one, okay. So we're just gonna talk through it, and then you'll actually do it for me, okay?
Okay.
So you would wipe down this finger. You already have your test strip in the glucometer,
Okay.
but you need to get the blood from your finger to the glucometer. So we have a lancet.
Perfect.
Okay, so what you're gonna do is take the cap off the bottom,
Okay.
and if you look inside, there's a needle in there. It's really tiny, and basically you're gonna push the part that has the needle onto your skin, and you're going to push the top
Okay.
little button, and it will poke your skin. And you can either do it on the pads or on the side.
Okay.
Safer to do it on the side, but I know some people prefer on their pads.
Okay.
And then you'll get a drop of blood, and once you do get a drop of blood, you can take that glucometer, making sure it's still on, and put the blood on the test strip, and it will tell you what your blood glucose is. And if you want to put on a Band-Aid or a like cotton ball, you can do that after.
Perfect.
Okay, so why don't you, I'm gonna put everything back in here, and why don't you show me how to take your blood sugar.
Perfect. So this is my alcohol swab, the lancet, my glucometer with a strip, and then a Band-Aid for after. So we can set that down.
Hold that for you.
So you said clean it off first. So I'll clean off the finger as much as I can.
Yes, and you're gonna let it air dry. I forgot to mention that.
Okay, so don't blow on it.
No, don't blow on it.
Perfect. So now that it's dry, I take the lancet and I stick it
So
face.
what do you want to do before that?
Make sure my glucometer is ready.
Yes.
All right,
So that
so
you're not scrambling.
I'll turn it on and stick in
The test.
the test strip,
Mm-hmm.
and then I push the lancet onto it and press the button,
Perfect.
and then I see blood coming out, so I stick that end and grab some blood, and then this is reading it. I can just stick on a Band-Aid or whatever right now and hold it,
Mm-hmm.
and then now it should read my blood glucose.
Exactly. Perfect. Do you have any
Perfect.
questions about that?
I don't.
Okay, it makes sense?
Yeah.
Perfect.
Alright, I'm going to ask you a few questions. I have to ask them to everyone, so just know that it's normal for everyone that comes in here, okay? Have you ever experienced depression or anything like that?
We do have a little bit of depression on my family side, but as of right now, I think I'm okay.
Perfect. I know you said you live alone and your family's far away. Does that trouble you?
It does. I mean, it's hard. It makes me a little anxious, but just kind of.
Have you ever had thoughts of suicide?
Nothing like that.
Okay, perfect. Good to know. Those are all my questions for right now. I'm going to teach you, or Sione, you've been having some issues with some pain levels, you were saying. I'm going to teach you some ways to help with those pain levels that may not be with pharmacological practices. So we're going to do some breathing techniques, we're going to do some guided imagery. Are you okay with that?
Yeah, that sounds great.
All right, do you want to start with the breathing techniques?
All right.
All right, so we're going to make sure you breathe in through your nose and out through your mouth. So let's start with in through your nose. Breathe in over 5 seconds.
The nurse performs deep breathing with the patient.
Hold it for a couple seconds. Out through your mouth. All right, let's do it again. In through your nose. Out through your mouth. And that's just going to help your body relax. It's going to help take away some of the easier pains that you can get rid of, okay?
Okay.
And then next we're going to do some guided imagery. So I'm going to have you close your eyes. I'll play some relaxed music. Is that okay with you?
Yeah, that sounds awesome.
All right, let's start with this. So just go to a place where you're happy. Go to the woods, go to the beach. Think about calming things.
The nurse may also instruct the client to relax their muscles, inhale and exhale, and think of a calming scene.
Sione, I'm here. I'm going to take some of your vitals real fast, okay?
Okay.
So, get this ready. I take these. We'd simulate this. Sure. So, alright. And then you were complaining about some pain when you came in. So what's your pain level at right now?
I say it's about at an 8 right now.
Perfect. I'm going to continue to monitor that for every 4 hours.
Okay.
While I'm here, I'm going to listen to your heart and lungs and get your pulse and your ox. So I put on an ox if we had an oximeter, and now I'm going to listen to his heart. So I'd listen to his heart in all 4 spaces for 60 seconds. And then once I reach the apical pulse, I'd check it for 60 seconds and count that. While we're continuing our conversation, I'm watching your breaths, watching your chest go up and down, not letting you know I'm doing that so we can continue with like a normal conversation about everyday life. Make sure you're calm and watching your respirations.
Come in.
Hi Sione, you've been laying in this position a while. Is it okay if I help you move?
Yep.
Okay, perfect. So right now you're laying down, so we're gonna turn you onto a side. Do you have a side you like to go on?
I can go on my right side.
Okay, perfect. We're gonna stick this between your legs once we get you turned, all right?
All right.
I'm gonna help you turn. Perfect. Let's bend those knees a little bit. I'm gonna stick this between to prevent any pressure sores, okay?
Sione is able to move positions with minimal assistance. The nurse places the pillows between his legs.
Go ahead.
Have you ever heard of Alcoholics Anonymous or the 12-step program?
I haven't.
Okay, Alcoholics Anonymous is a support group that's completely anonymous when you go. They help you go through the 12-step program, and the 12-step program is all based on complete abstinence from drinking.
Okay.
So you'd refrain from any drinking from that point forward if you decide to go down that route.
All right.
We also have a social worker here at the hospital that can come talk to you about that, talk about other groups, other support systems that you might want. Would you like that?
Yeah, that would be great.
Okay, perfect. I'll have him come and visit you.
All right, thank you.